everything else is. All right, so welcome to all of you. I will remind you about the chat again, as I have been for a little while. So make sure you orient yourselves to the dashboard because we do want this to be interactive. You can find the chat on your dashboard. It's the single little thought bubble. If you can't find it there, it may be in the more section, so you can add on there. When you do chat, you can select who you talk to. So you can either go directly to a presenter, but you can also choose everybody. So, you know, so that we all are engaged and know sort of the chatter, feel free to select all panelists and attendees. And then we can each hear it. Or the other option is you can use the Q&A. And so we will be using the Q&A sessions. And yeah, so welcome. Yeah, I'll get right started. Everybody's keen. I put the slide up about our Radon Olympic event, so we might as well start getting going with our trivia. So our first trivia this morning is brought, oops, oh no, I went too fast. I've got it in a poll here, so I should be able to launch the poll for you. So the trivia is, how did Stanley Watrous contribute to the modern radon industry? I'll give you a few minutes while you check it out. All right, so the answers here: by inventing the alpha track detector, by lobbying for widespread residential radon testing, by triggering radiation monitors at his workplace, by developing the active soil depressurization system. So, all right, I only have half of you voting, so you know, you got to commit. There's no shame in getting the wrong answer, but it's all about the participation. So make sure you choose something and join in on our trivia today, so we can. Yeah, all right. I'll give you another 5 seconds, and then I'm going to finish it up here and end the poll. 3. Oh, come on, a couple more. We're almost up to 75%. We need one more person. There we go. All right. So, and then I will launch the results. And if I can maneuver in my presentation, aha, there we go. So 33% said by triggering radiation monitors at his workplace. And indeed, Stanley Watrous was a construction engineer working at the Limerick nuclear power plant in Pottstown, Pennsylvania. So in 1984, on his way into work, he set off the radiation monitors installed to help and protect workers by detecting any exposure to radiation at work. At the time, there was no nuclear source yet installed at the plant, so there was no way for Mr. Watrous to have been exposed at work. And upon investigation, was discovered that Mr. Watrous was being exposed to enormously high levels of radon in his home. The incident raised awareness of the fact that radon levels in homes can be elevated and exceptionally extremely high. All right, yeah, so thank you for joining us. As I was mentioning earlier, you can find our polls after each presentation on our conference website, our Radon Olympic Trivia on our conference website. Oh yeah, so the other, we were gonna get you a little bit of more information from you today. So I have another poll for you. As I go into talk to you a little bit about the agenda, I thought I'd find out a little bit about where you're coming from. So let us know what type of organization that you're with. While I give you a little bit, while you're doing that, I'm just going to go through our agenda today as well. So we do have 4 presenters that are going to talk to you today about the work that they're doing in radon mapping. Our first presenter is Jeffrey True with the BC CDC, and then we also have Colin Gucher with us from Health Canada, and Michelle Monti has generously given us some of her time. She's with the EPA, with the CDC in the US, and she's also been super busy working on COVID work there, so we thank her for giving us some of her time. And then also, I'll also just share a little bit about C-NRPP and the mapping work that we've been doing. Okay, so I'll give you a couple minutes. Great, we've got lots of radon professionals on the line. I'll end the polling and share the results so you can see who is joining us today. So it's great. We've got a good mix of backgrounds on the line, which is exactly what we were looking for. And now we want to know a little bit about where you're coming from. So if you can let us know. I put Manitoba and Saskatchewan together because we only have so many options on our polls, and I wanted to make sure we got some information for the for our territories. So let us know where you're coming from. All right, give you another second. Great. All right, and it's great. We've got a good contingent from Alberta, but also quite a few from across the country. So really great to have. Good. We've got a couple people from the territories. So, or one at least, a couple percent, but one person. All right. So I'm going to move right in to introduce Jeff to you. So I'm going to stop sharing my screen so that he has a chance to get ready. And so just a reminder for everybody, the way that we're going to work today, Jeff will, each presenter will do their presentation, and then we'll pause for about 5 minutes of question and answer. So you can feel free to use the chat or the Q&A sessions to ask your questions while he's speaking. We're going to hold the questions to the end, and we'll give each presenter a chance to answer the questions, and then we are also going to have an open discussion after all the presentations. So I'll open up the phone lines, bring in the discussion, and we can have an open discussion at the end of the entire presentation. All right, so with that, I'm going to introduce you, Jeff. You should be able to load your presentation.
Just click the share screen button. So
yeah, we can see it now.
You can see my PowerPoint page there, and I'll just full screen it. There we go.
Yeah, great. Then you're ready to go.
Right. So hello, everyone. Jumping ahead a little bit. Thanks for joining on the line. So I'm a project manager at the BC Centre for Disease Control. We're a public health agency here in the province. I work in our environmental health services section. And other than radon, I support projects mostly related to air quality, residential wood smoke, fire smoke. Today, I'm going to be talking about an initiative we started up in this past year, and that is to collate BC's indoor radon data into a central repository to be held here at the BC CDC. This initiative in particular is funded by CARST Canada, short for Carcinogen Exposure Canada. They're a multi-institutional group of researchers interested in reducing Canadians' exposures to carcinogens. So I hope you'll see shortly how this initiative ties in neatly with that mission. Just before going forward, I'd just like to acknowledge that I live and work and currently giving this presentation out of the traditional, ancestral, and unceded territory of the Coast Salish peoples, the Squamish, Tsleil-Waututh, and Musqueam nations. Right, so in BC, and I'm sure in many other jurisdictions, indoor radon data is held by a variety of parties. You humor my use of emojis here that can range from a homeowner purchasing a detector and testing their own home to industry professionals from the measurement, mitigation, and analysis side of things, to research groups, community engagement groups, health agencies, and government groups who have coordinated wide-scale testing. In short, there's a lot of radon data out there. It's just currently all held separately. And this presents a challenge if you're looking to do any form of analysis or, say, create the Great Canadian Map. What we're trying to do is put these puzzle pieces together in what we're calling the BC Radon Data Repository, or BC RDR for short. Overall, beyond its initial use, we're trying to show that this data is more useful together than it is separate. And we want to do so and make the repository to be in a secure environment, again, at the BC CDC. We want it to be living in the sense that contributions can be made into the future and uses can be drawn into the future too. So it's not like a one-time integration or analysis and mapping project. We want to make the data accessible for others for research and mapping work. And we want to make it accessible in a manner that's flexible in use. So I'm going to talk more about our data integration and stewardship practices all around the project a little bit later, but I want to start with a couple of projects that have been done in the past in BC that integrated radon data, just to sort of as a means to frame this current work. So this is from a 2013 pub. The 2014 uses the same sources. They collated data from these four key players to about a total sample size of 3,900 observations. Just highlighting the Health Canada subsection here, 1,800 observations from the Cross Canada Survey of Homes, mostly because that's a data source you would commonly see in BC maps and Canada maps alike. The 2014 study aggregated this indoor radon data to the local health area level, that's the boundaries you can see on the map, to categorize those units as low, moderate, and high exposure. They found that in the high radon health units, lung cancer mortality has been trending upwards, particularly in the health units where smoking has been more prevalent. This is from a 2016 publication, a couple of new sources this time, none from Health Canada, and overall increased their sample size by a few hundred. They fit this radon data with geologic data to output a model of indoor radon vulnerability, again, categorizing as low, moderate, and high risk. It's my understanding that's about it. So a couple takeaways from these projects. I think we can see, and it's fairly evident, that project by project data integration can miss key data sources, and it's incredibly time consuming. So streamlining the process with a central repository and be more efficient for all parties involved, from the contributor's perspective and the user's perspective. Secondly, we can see a considerable amount of small scale variation if we look at the right map of the radon vulnerability model. And that probably doesn't come with much surprise. We do know that radon varies quite a bit, even from household to household. I think this just underpins the value of aggregating as much data as possible so we can enter sample estimates as close to what the true population exposure is when it comes to mapping of exposure or doing any form of research or analysis. With these in mind, and what we knew was out there at the onset of this project, our conservative estimate of what the initial repository can hold would be about 10,000 observations. So I'm just seeing in the chat there, I'm just double checking if it's audio or connectivity issues, but it's okay.
Yeah, no, that's okay, don't worry.
It's all good, yeah. Yeah, so conservatively about 10,000 observations and optimistically upwards of 20,000. Based on our conversations with data contributors to date, I think we're gonna land at the initial repository around 15 to 17, so about the median of that range, hopefully a little bit more. So at the moment, data sharing talks are underway with a variety of parties to a variety of lengths. I'm just throwing up some logos here to give a sense of some of the confirmed and potential contributors at this point in time. So you can see they're mostly the health agencies here in BC, Canada, as well as some main players in the industry and research side of things. To achieve the goal I described earlier, having a living repository where contributions can be made into the future and uses can be drawn into the future, we would really need to engage at the beginning with these main players, and that's where we started. We're formalizing this with a data sharing agreement. This is pretty standard for this type of effort. The agreement outlines various data handling procedures, various data security procedures. Just for example, the repository is held on a limited access, routinely audited server system at the BC CDC, the same that would hold a number of other sensitive public health data sets that the BC CDC holds, for example, communicable disease records. On a high level, I just want to hit some key tenets that the agreement covers or frames the relationship as us as a data steward and a contributor to the repository. And first, that would be a contributor would continue to own their data while giving custody over to the BC CDC to, of course, clean and integrate it. And what this means in a practical sense is that they're only providing custody or only sharing under the premise that we are using it for public health research and mapping work, and only release it to others to do the same. And if at any time a contributor would like to terminate this agreement with the BC CDC, we would simply extract that data subset from the overall integrated repository. As well, there will be no attempts to re-identify individuals or households with the BC RDR data, and there'll be no attempts to link this with other data sets on a person level. And what this means is we're not looking for any person level information when it comes to this data integration. What we are looking for is all other possible information in regards to the radon test. When that comes to the concentration itself, any implicating factors, home and testing metrics, sampling information or metadata, if you will, if this is part of a broader collection effort, when the test took place, where the test took place, and overall just the 5 W's and H's when it comes to the radon testing, with the clear exception of the who. Again, not looking for that W. At this point in time, we're not looking to be restrictive in terms of integration and just trying to get as much breadth and depth as possible. And simply is documenting as much as possible as we go along. Now, since we're not looking for any person level information, the only potential quasi-identifier here that we would have to think about de-identifying or anonymizing is this spatial construct or spatial variable. Now, there are many ways to describe where something is. You could be incredibly broad or you can be incredibly specific. But what we want to do here is strike a balance between anonymity and usefulness, considering all the other variables involved and sort of the data release process. And to illustrate that, this is the location info of my workplace in Vancouver, BC CDC. So using Stats Canada's postal code conversion file, we can geocode 6-digit postal codes to a point. You can see this on this OpenStreetMap base layer here. It's a blue dot kind of closer to the bottom there. We would then apply a systematic random jitter to this point. The donut around the original blue point illustrates the minimum to maximum radius in which a new random point would be generated. That new random point is the black dot. And it's systematic in the sense that the size of the jittering donut is inversely proportional to the underlying population density. So here you can kind of surmise on the map, right? Other than the hospital around and the other health agencies around the BC CDC, it's a pretty dense urban area. Most of those buildings to the south there are mostly mid-rise apartment buildings. Again, it's fairly dense. So you really don't need to move the original point very far to obscure it from all the other potential postal codes or locations in the area. And here's just a smattering of some few other postal codes in the area. On the other hand, in rural and remote communities or sparsely populated areas in general, this jittering donut would be much larger because you would need to move it much farther to, again, protect the anonymity. Now, what would be released in the end in the clean and integrated data set would be these anonymized jittered points and larger geographic units, like a forward sortation area, like a local health authority. A forward sortation area is just the first 3 characters of a postal code. They're typically very large in geographic extent. They would cover whole sections of big cities or large geographic regions of provinces, or sorry, rural areas of provinces. In the event that an observation is in a rural area or, again, just a sparsely populated area, we would, again, need to move it rather far. And to do that, we would essentially be introducing too much spatial error into the data. So what we're really capping is we wouldn't apply jitter coordinates to anything that could potentially be moved beyond 500 meters. In BC, actually, this is a very small minority of observations. If you think about it, the vast majority of folks do live in urban centers. And even those who live in more rural communities, they typically do live in like residential communes or town centers. Keyword there is majority, not all. Now, I do want to end this point here and to stress that the point of this is not for us to publicly release point-based maps, but rather provide flexibility in use, to provide us down the line or approved external users the ability to take these anonymized point-based observations and roll them up to other geographies, other boundaries that are relevant for their particular mapping work or their particular analysis, to create clusters of observations if needed, or to overlay to other grids or boundaries of data. And I think doing this with 6-digit postal code with this anonymization technique can really strike that balance I was saying earlier between anonymity and usefulness. Now, from talks with data contributors to date, there's some that have said they can't share their data to the as refined as 6-digit postal code, given agreements made at the point of data collection, and that's fine. We're not looking to bypass any initial consent forms or ethics review applications. We're keen to accept whatever a data contributor is able to share. On the other hand, some contributors are able to share the full address string, and that's fine as well. We would geocode that not with the postal code conversion file. Rather, there are many ways to geocode an address string. We would use the BC government's physical address geocoder to get it to a point and then apply the jitter. It's the only approved address geocoder for the BC CD given its server location, and various other data security measures. So the repository data will be made accessible via an application process. This is standard for other data requests at the BCCC. An individual would fill out an application stating the project objectives, expected outcomes. Team members would have access to the data and data handling procedures. This is a pretty standard data request application. The main thing that we're looking for here is if the objectives fall under the description of legitimate radon-related research or mapping to support health protection and policy initiatives. Now, the data that would be released would be specific to that request. So just for example, if the request is to do the type of work in the first publication I showed, an analysis at the local health area level, where the point-based geographies wouldn't be relevant, then those wouldn't be released, just the local health area. Another example is if a health authority or municipality is only interested in observations in their particular region, then we would just subset the repository to that and before releasing it. Lastly, the BC CDC would, and sorry, just say we, would contribute to review data requesters' outputs or publications down the line. And our level of involvement here would really vary on the request. This is just a potential mechanism for us to extend our stewardship beyond the point of application and release. So as I mentioned, data sharing talks are underway with a variety of parties. So in the near future, in the coming months, we're hoping to move to finalize with these various parties and engage with others as well. Just acknowledging that this is an incredibly busy and turbulent time for many of the individuals and organizations involved, and trying not to rush what doesn't need to be rushed, but still trying to chug along with this project, of course. At this point in time, I would be remiss not to say, if you are on the line and you are a Radon data holder, whether you are an industry professional or you are part of an organization that, that holds Radon data, again in BC, that's the scope of this project at this point in time, reach out to me. Let me know. I'll have my contact info on the last slide here. If you're keen to support the project or contribute your data holdings, I hope overall in this presentation I have outlined our data stewardship practices that can show how you can breathe a second life into your data holdings, where the first life, of course, would have been to inform the degree of exposure and any mitigation that could have occurred in that particular space that was tested, where the second life can inform further research, further mapping, and overall inform health protection work to reduce the burden from radon-associated lung cancer. So that's about it for me. Thank you for listening. Just references from the couple publications I threw out there earlier. Again, my contact info here. And just before closing and passing off to Pam for the Q&A, I just want to quickly acknowledge, again, a funder of this project, CARST Canada, and internal contributors, Anne-Marie Nickel, Kieran Aiken, and Sarah Henderson. Thanks again.
Great, good. Thanks so much, Jeff. I will take a time for questions now. I'm just chatting out your email for those so that they can copy your email address or
sure, yeah.
copy of that into the chat. And we have had a couple questions. So just a reminder, actually, Aaron, maybe I'll get you to repeat this, but anybody who would prefer to ask a question in French, you can type it in either in the chat or the Q&A widget to ask your question, and I'll read out the English questions, and Aaron is here to read out the French.
For sure.
All right, so first question for you, Jeff, any value to including data sharing clause from services like BC Lung, although I think you probably answered that.
Yep, so we're working with BC Lung. You probably saw their logo up there, and yeah, we're working with them to finalize the data sharing agreement.
Yeah, and I think I saw the logo also for the BC First Nations.
I don't believe I put up there. We've started those conversations, but at this point in time, they would need to get consent from all the involved nations. So just we're not too far down the road with those talks that I feel comfortable just throwing their putting their logo up here.
Okay.
Again, I guess I just want to stress with those logos that I put up, those aren't all confirmed contributors. Again, just potential. And the main idea is at this point in time, for the purpose of this presentation, just wanted to give the audience a sense of who would be involved.
Yeah, or who you started talking with already.
Exactly. Yeah. But yeah, the First Nations Health Authority would certainly be, I would certainly be keen to have them be a data contributor, but it all comes down to consent. And as I was saying earlier, this is, you know, a data sharing initiative, not a data wrangling initiative. So just being patient with that process.
Yeah, great. One question about radon mapping, with the fact that radon in its nature, one house could be high, one house might be low. Yeah, do you want to just address that?
Sure, yeah, there's certainly a considerable amount of variability. I think I saw in the Q&A as well as how in those studies they categorize low, moderate, and high. And in those studies, and sorry, I'll just answer that first because I think they'll tie in neatly with this of how it'll address amount of variability. In those, they had threshold based on Health Canada's guidelines, just for example, like percentage of households above 200 becquerels per cubic meter. And I think that's pretty useful just because when there's so much variability, if you were to just put a mean or a median, some kind of representative value like that, a one-time really low value or one-time really high value can really skew this mean or median. But rather, if you just say something along, if you summarize it, I should say, with saying, say 75% or 50% of the households in this particular region are above a threshold, are bad, in other words, I think that's one way to address quite a bit of variability when it comes to the radon variation when it comes to mapping. Yeah.
Are you able to review people's previous consent data sharing to help them understand how much they can share with you?
Certainly, yeah.
Okay. Apparently high levels of radon have been detected in homes on Vancouver's North Shore, but it's not showing on your map. Any thoughts on that?
Sorry, what do you mean our map? Or is it the ones I showed earlier? Or?
I think so, yeah.
Oh, okay. Yeah, I mean, it would really depend on what data sources were included in those studies. And I do know what you're referring to, and in more recent work that has been done, particularly by Emery Nichols' citizen science work at SFU, has found a considerable amount of high value, high level radon observations there. But I guess, yeah, that's just another point, integrating as much data as possible from all possible sources so those can all be communicated effectively, rather than just these one-off studies that may miss some of those sources.
Yeah, I think each presenter is going to probably talk about the fact that you can only show the data that you've got.
yeah, that's yeah, exactly there. Yeah.
All right. So just a follow-up to one of the questions about do-it-yourself detectors, and I think that that we've already talked about this. That if we can get the source of the data, depending on the data sharing agreement or the information that the permission has been given on the do-it-yourself test kits, then the company that holds that data could share it with you, right? Regardless of who does the test, whether it's a professional or a homeowner, you would take all that data if the organization is willing and able to share it with you.
Yeah, and that really depends on, as you're saying, the agreements or the terms and conditions of, say, purchasing a product and this and that. But ultimately, it comes down to the comfort level of the contributor, or in this case, the organization that holds it. It's hard just to give a broad sweeping answer because it just depends really, and that's sort of when I'm saying these data sharing talks are underway. That's pretty much what mostly the talks are involving. Saying, okay, hey, we have this subsection, we're interested in contributing. Hey, we can share this section. This section we gotta check and yeah.
Yeah, great. If a real estate developer submitted a proposal to a municipality, would the developer have access to the status of radon in the proposed area through the municipality?
If the municipality requested data from the repository to get a sense of their radon levels in their community, then yeah, then sure, then that would be, in my opinion, a very legitimate request from the repository to say, hey, like we're municipality A and we want to get all our observations in our municipality and potentially some of the area around it just to get a sense of the radon levels here and maybe variation within city variation. And for the purposes of communicating to developers, I think that, but yeah, of course, that would just depend on the municipality, of course, then looking to request and do that.
Mm-hmm. Okay. What level of radon is considered high, moderate, and low?
Yeah, I mean, it depends on study to study. For the publications I showed there, I can't rattle off the criteria off the top of my head, but that's something you can certainly send me an email and I can share the publication with you and or just summarize it back. As I mentioned earlier, when it comes to the 2014 one, the first LHA map, it was a percentage above certain thresholds. So just for example, high was a certain percentage. Again, I can't recall off the top of my head, above 600 becquerels per cubic meter, moderates like a certain percentage between 200 and 600, et cetera, et cetera.
How are observations being standardized for aggregating comparison with larger spatial areas, so like FSAs? For example, tests of different durations conducted at different levels of floors within a building.
Yeah, so once we do have the initial repository, what we would like to do is do just sort of preliminary report on findings and do those data quality checks and just say, okay, like everything above, just for example, like length of time of test, right? I know the standard is about 90 days, right? So we would say, okay, this is everything above 90 days. This is the average. This is the median, et cetera. Everything below, does it vary quite a bit? We would do those sensitivity analyses to see if the results are sensitive to those factors, whether it's missing data or in this case, in this example, a shorter length of testing. If we don't find too much variation there, then we can just report it all in a summary statistic, again, like a percentage above a certain threshold. If not, then we could then reasonably deem this as unreliable or bad data and remove those. But it's hard to say, for certain what we're going to do A, B, C without seeing everything that comes in at this point in time. As I mentioned earlier, we're just looking for as much breadth and depth as possible so we can get to the point where we can make those reasonable decisions rather than being too restrictive at this point in time.
Great, good. And I think there's a couple of questions more that are really going to be great questions for the chat. So I might bring them back up. One question about the fact that in BC, the municipalities, the building code requires certain municipalities to be included in the radon rough-in, and some are not included. So it is valuable to have this data for those municipalities. Yeah,
I 100% agree. And in talks with folks from the Ministry of Housing, they've advised the same, that they're excited about this work and that they feel like this can support those decisions.
Yeah, and just a qualification, I think Anne-Marie put onto the chat that North Vancouver readings, the majority of North Vancouver readings were below 200 becquerels, so just qualifying a statement.
Appreciate that, thanks Anne-Marie.
One more question, did you distinguish radon data collected during different period of the year, or are all the tests, all the data were used to map the radon potential?
I'm assuming that's talking about one of the studies I showed there earlier. I wasn't involved in any of those ones, so it's hard for me to speak to the details of them. From my memory of reading up on those articles, I don't believe they restricted their data set based on time of year, but I believe my screen is still shared, so I'll just pop back to the references. Okay. Oh, is it not?
Yeah, it is. I was just clicking to.
Oh, okay, there we go. Yeah, so yeah, just feel free to take a look at the publication yourself, or as I said in an earlier answer, feel free to send me an email and I can take a look and we can have a conversation about it.
Good, good. All right, well, and I'm going to move on. So, I mean, if you've got questions for Jeff, we can certainly revisit them later, but we are going to move on and have Colin join us. And so I'm just going to take, actually, I'm just going to get you, Jeff, to stop sharing your screen. It'll be the easiest. Perfect. All right, Colin, I'll get you to start sharing your screen as you're ready.
Okay. Good afternoon, everyone.
Great. And there's a few people who have joined us just since the introduction. So I'll just orient them a little bit. You can feel free to ask questions using either the chat or the Q&A, while Colin does his presentation. And then we will stop at the end for times for Q&A. And then we also will have an open discussion at the end of all the presentations. Great, we can see your presentation now, Colin. And so Colin Gutcher is with Health Canada. He's working with Michelle Gauthier on the line. And so I think they're both here to answer questions, also in both English and French. And so I'll hand it off to you, Colin.
Thanks, Pam. Yeah, thanks for the introduction. Like she said, I work with Health Canada as part of the Radiation Protection Bureau. And I work here at I'm the spatial analyst here at the National Radon Program. And for those of you who aren't familiar with our program, it was started back in the early 2000s to help reduce radon deaths and related lung cancers. And we've been doing this through guidelines, very successful media campaigns and education campaigns, as well as like doing research to help characterize and understand the context of the problem for Canadians. So like I said, I work in the data management and mapping, and that's what I will be discussing with you all today. So the main thing that my component does is I support the other components by providing information, insights, so that we can make informed decisions about where we spend our monies and efforts, how we do outreach and research, what sort of policies we recommend to various stakeholders. And the data management portion came about so that we could centralize our own data from all the different pillars of the program into a central location to ensure that we have better data integrity. And it also makes the stewardship easier in terms of man hours and whatnot. We manage all our own data on internal servers. And presently we have about 35,000 radon measurements. Again, like most of our information is our own. And then the second component is the mapping component. And really that's where the bulk of the cool stuff happens. We use that to create effective communication tools, as well as developing models to help us understand the scope of radon at a national level and understand where the risk areas are for Canadians. I've broken down our data management into internal and external sources, and I'll talk about that later. But for now, let's focus on the communication visuals for our mapping component. And so what I want to highlight with this slide is how effective visuals can be at sharing information with a viewer. If you look at the table on the right, it is actually populated. It has like the exact same information as the graphic on the left there. And it just goes to show how much information and data you can shove into a well-designed graphic. And it's easier to digest and understand what's happening with that information for a layperson. Whereas with tables and other delivery methods for data, they can be a lot more intimidating for a layperson or for someone who isn't as well versed, and a lot more prone to misunderstanding something. The other side of that coin, though, is that the person, the cartographer or the graphic designer, has a lot more impact in how the viewer sees that information, whether it's color choice or whether it's how we decide to bin that information. So that's something that we are cognizant of and trying to keep as pure as possible. And so for those interested in seeing a radon map that we've done recently, we reported all of our Cross Canada survey information at the Health Canada level, which is the map you just saw earlier. And so if you go to our website, canada.ca/radon, and you click at the radon map button around the top left side of the page, it will bring you to this interactive map where you can see your health region and mouse over to see what the average level was and whatnot, or I guess it's the percentage over of homes that tested over the guideline of 200 becquerels per cubic meter. And that was a blog that we released back in November as part of Radon Action Month. So next is the spatial analysis part. And really this kind of goes to what Jeff was talking about, and we're trying to develop maps that contextualize the radon across the whole surface of the country, and not just seeing piecemeal bits of data from various homes of the different data sets that we have. So a really brief rundown of what modeling does and why we use it is it's mostly used to fill in those knowledge gaps and help simplify really complex systems, which you often see in the real world. And when it comes to mapping or modeling spatial information, there is a lot of different approaches, each with their pros and cons. It can be something as simple as linear interpolation, which is drawing a line from one point to the next, all the way to multi-components, which is adding each individual layer and then summing them up. Or it could be using something really complex, such as machine learning with an artificial intelligence. For our own modeling, we don't go anywhere near the right side of that. It was, we've been developing two models. So previously we used a geologic heavy input model. That's the map on the right there. And if you can see, like, blue is low, yellow is medium, red is high. And that uses a lot of bedrock and various geologic information. And what we found is that it works well for the test area, but when we try to extrapolate that to the national scale, we were running into some difficulties. And so we've decided to move towards a indoor measurement focused model, which is what you see on the left there. And that's something that we can talk about in more detail for those interested later in this presentation. So like I said, there is some challenges that we have in the Canadian context, something that you might not see at the provincial or local scale. And most of it has to deal with how large Canada is. So one example is our incomplete coverage of information. So the image on the left there is our superficial uranium measurements that we have access to. And you can see that covers maybe at best 60% of the country. Albeit a lot of the populated areas, but you can see like BC is just totally left off the map there. And that is probably our most, apart from our indoor data, the most robust geologic information that we have. We have, for example, we have soil gas measurements, but that doesn't even cut it close to doing a map at this scale. And the second issue we run into, which is not as troublesome, but something you need to be cognizant of, is inconsistent information between regions. And this really crops up when you start collecting information from the crowd. So that is the geologic bedrock map, and every province does their own mapping. And so when you stitch them together, you kind of notice the small differences that you see in how various field reports were interpreted or how the lines were drawn. And it's not the largest challenge to overcome, but it's definitely something that needs to be cognizant of when you're stitching together these different components. And that also translates forward into indoor radon measurements as we look to collect from third parties. And so going back to that indoor radon model, I want to kind of break down what our model is looking like. So for those of you who aren't really interested in this, you can tune out for a slide or two. But essentially what it is we take all of our indoor radon values and we take a bedrock unit and we use like a cookie cutter to cut out all of those indoor radon values. We then use a statistical method called kriging, and we use that to develop a average radon value for the whole cookie, for lack of a better term. And then once we have that cookie cut out and we have the radon surface applied, we stitch them all back together, and that gives us our national map. And what you see here is the Saskatchewan map we've developed. It's Saskatchewan because it was a good place to test this methodology, and we are doing a lot of trial and error to get this methodology dialed in with Saskatchewan. And then, so now that we have this methodology dialed in, we're looking to expand this at the national level. And as you can see, there's four different colors. There's the gray, that's no information, and then various shades of red. So pink is low, and instinctually the dark red is high. And that's based off of, like Jeffrey said, it's based off of, we're using the same thing, percent of houses over the guideline. And what we're really looking at communicating is that risk involved rather than actual measurements. We find that using appropriate and understandable communication vocabulary is a lot more effective than telling someone there's a 10% chance or 20% chance or 1% chance or whatever it is. So that's what we're doing with this internal modeling. However, for the broader context, it's still an ongoing discussion of understanding where, what constitutes high radon at the public health level, as well as like the geologic components that contribute to that. So for our previous geology model, we came across high areas that had a uranium measurement of 2 at the surface, and that's a unitless measurement for those confused. Or for bedrock units that had over 10 parts per million of uranium in the geochemistry of it. So the main two sources of information that we have is our radon survey. This is based on our one across Canada radon survey, and we're looking to add our other data points into this model as well once those get geolocated. And in terms of congruity of the data points, they're all 90-day alpha track detectors. They're all guideline compliant, so they're all done in the winter at the lowest level lived in. The only issue that we've come across is our geolocation hasn't been the most accurate. So approximately 60% of those measurements are rooftop accurate, which is where the house actually is. And the other 40% vary from postal code to city, which, you know, depending on where you are in Canada, it's 100 meters or it's 100 kilometers for the northern postal codes and FSAs. And then the other component, like I said, is the bedrock. And we really only just use the bedrock as the shape to categorize our radon. So like I said, it's the cookie cutter. And we are doing that at the regional scale because of how much measurements we have. And it's what the provinces have readily accessible for all of us as well. So that's what we're doing on the mapping side. And in terms of the data management, I really want to stress that there's 2 different streams of data here. There's internal sources, which make up 99% of the information we have now. And then there's also the external data sources. With the internal data sources, it's mostly been, they mostly come from research areas or research projects, most of which can be found online. If you're interested, you could go to the government's open data portal and just search radon, and you'll find all of our information that we have available. The next data set that we're planning on making public are the occupational measurements from the Federal Building Survey, and we're looking to publish those around 2020. Mind you, that was before this pandemic hit, so maybe give us a little bit of leeway, 2021, but we're still planning by the end of 2020 to have that online for those interested. And then for our external data sources, like I said, we have a little bit, but we are really looking to get a lot more, as Jeffrey very eloquently described the reasons why. So Health Canada, in collaboration with C-NRPP, are interested in collecting more information that will help us narrow in our models to get higher resolution. It'll also strengthen those models as well, reducing the error involved that we have. And the only concern that we are really concerned with is ensuring that we can collect this information in a way that ensures the data integrity of anything that comes off of this data with the mixed origins, so that it involves making sure that we don't have duplicate houses and like we record when the tests occurred and whatnot. The second thing is that by collecting all this information, we really get a multiplicative effect, and that gives us that will allow us to make tailored products for municipalities and provincial governments, which will then encourage them to make evidence-based decisions and hopefully come up with radon reduction policies. This is a perfect example of how we support the other components of our programs. I'm really sorry about this autoplay I have going on. There we go. Encouraging radon reduction policies. So this is a perfect example of how we support the other components of our program, in that our education outreach are developing toolkits for municipalities and provinces that are interested, and they are highly customized to that individual locality. And by providing these models to support those policy suggestions, really helps bring it home for these individuals requesting these toolkits. And lastly, probably one of the most important things is touching on how we actually protect personal and confidential business information. And so, like I said, I want to stress again, because I feel like this is the largest misnomer about sharing data with government, is that it becomes public information, and that's not the case at all. So with internally sourced data, all personal information is protected because of the Privacy Act. It has very strict care and custody requirements, and the main thing is it's exempt from the Access to Information Act. So even if someone wants to ATIP the information, it's going to be redacted, and you really won't see anything. And then the second thing is for externally sourced data. This is the key part. The personal information is still protected by the Privacy Act. And also, when information comes to us from third parties, if they consider it business confidential and treat it as such, then it's also exempt from the Access to Information Act. And that's the biggest takeaway here, is that there's legislation in place to encourage this data sharing, and that also protects interests involved. And these can be enshrined in information sharing agreements, some of which we've drafted, and we can share and modify as needed. So really, the takeaways from this presentation are that we're developing models for internal use to help make evidence-based decision-making, and that we are looking to crowdsource some data to help strengthen this evidence, and that we are going to keep information safe. And for those who are interested, we have publicly available information, again, separate from the personal information and the business confident information. You can find that at opencanada.ca. And really, the takeaway is that we're doing all of this to reduce radon risks and help protect Canadians here. So thank you all very much. If you're interested in general, you can contact the email on the slide or visit any of the websites there. I'll post my personal email in the chat for those who want to discuss data management or spatial analysis. Thank you.
Great, good job. Thanks very much, Colin. That was really great information. So I'll check questions. Does anyone want to address how we're dealing with some of the unintended consequences of publishing maps? Environmental site assessments are still claiming that that certain sites are a low risk area and they need worry about it. Or commercial building owners seeking sustainability certifications are still asking if they need to, since they're in a low radon area. I know this might be a question for our greater discussion later, but Colin, do you want to comment on that?
Yeah, so really we're concerned with providing information and letting people, we're concerned with providing information in a understandable way and then letting people make decisions based off that information. We're not here to hold anyone's hand, but that being said, people really need to understand that these models are at a much larger scale. So these are regional, provincial models that characterize the radon risk at that level. And then when you start looking at individual sites, the uncertainty and randomness involved is really much too high to model at a accurate level. And that these are just guidelines, and that when you start looking at individual sites, you really still need to test no matter what.
Good. Another question about including risk in the map. Would it be possible to map radon risks taking into account gradual levels like we do with altitude on a map?
I'm sorry, I'm not quite understanding.
I'm trying to see if, New Brunswick represents 6% of the sample number. Would it be possible to map radon risks?
Like based on the population weighted?
That's what I was thinking that the question was about.
Absolutely. So if you are interested, the report for the CARST Canada survey has weights that are population weighted. So when we say, also a lot of our messaging has already been weighted that way too. So when we say 7% of Canadians are over the guideline, that's a population weighted estimate. And when it comes to our mapping efforts, the other thing to understand is that this model is an exposure model. So we're looking at creating this, and then when we want to interpret the population effects, we would then layer that over top as well to get a new output.
Okay.
Does that help?
I think so, yeah. How about are you planning on including the Thoron study?
Yeah. So do you mean like in our modeling work, or
in the maps that you currently have public?
Yeah, it's a work in progress right now. So right now, the only survey we have geocoded is the Cross Canada. And then once that is, all the bugs are worked out of that, and we've got that verified, then we're going to move on to the Radon, Thoron, and the federal survey, and those will get added to the model as the data rolls in.
Okay, the federal government was also involved in one in First Nations communities, and then another in Winnipeg, and another of metropolitan areas. Have you considered including all this historical data as well?
I think the metropolitan area one might be the Radon Thoron survey. I don't want to.
Yeah, I'm pretty sure that's it.
But I'm pretty sure that's it. Yeah. And I'm pretty sure the Winnipeg was part of the Cross Canada, but again,
no, there was historical data.
No?
Yeah.
Oh, okay.
Yeah.
I don't think we have that historical data, to be honest. Do you know, Michelle?
I'm not sure we have it. Yeah, I don't think.
Yeah, there was.
Go ahead.
There was some loss of records for anything that was done before the program existed, essentially, unfortunately.
Okay. Are you aware of any data collection of elevated radon household levels being due to either fiesta-ware or rock collection containing uranium-238 or radium-226?
I don't know of anything like that. We did a study on building materials and the radon that was off-gassed from that, and that test concluded that the exposure component of building materials was negligible. I would assume, it depends on the rock that you have, but I would assume that that would also be negligible and would also be incredibly local. Like you'd have to stand next to your rock for 4 hours a day.
Are post-mitigation radon tests included in the data, or have you identified that?
So all of our internal data is pre-mitigation. But if we start getting external information, that is something that we have to, we would need included in anything that comes in so that we can filter those out.
Okay. Is Health Canada planning on repeating the cross-country survey?
Not, yeah, not soon.
Okay.
Yeah, maybe in a decade or two.
Yeah.
Once the federal workplaces are added, will there be any differentiation between radon levels in commercial buildings versus houses? This
Yes.
is an important design, operation, and occupancy of the building are different.
Yes. I guess I misspoke a little bit with the federal building survey. So the federal building survey is made up of two components. There are residential houses that the government owns, and some of those will be included. Some of those are considered secret and there's nothing we can do. And then the other component is the workplace, the office and industrial buildings, and those aren't going to be included in the modeling because, like the question suggests, that they are very different.
What are the scales of bedrock maps across Canada? Is it varying a lot from province to province?
So almost all provinces have the regional scale that we're using. So it's 250,000 to 1 scale. Some provinces have larger and smaller scales as well. So Saskatchewan also has a 1 in 1 million and a 1 in 100. Ontario has 1 in 50. So yeah, it really is province to province.
And I'll just do a couple more here and then we'll have to move to the next presentation. But a question about intellectual property rights. If a radon company conducts a test at a private property, who owns the right to that data, the homeowner or the company?
I would not know how to answer that. That's out of my field, unfortunately. Yeah, sorry. Is there another panelist who's more experienced in contract law?
Yeah, I think that is something that we're going to discuss later, so we can get to that, no worries. And I think that, could mining companies have more data on the uranium locations that could be shared?
Absolutely, yeah.
Good, all right, I'm going to move on. I will post, or Colin, actually, I'll maybe get you in the chat just to post your contact information so that people, I had typed in Jeffrey's email address so people could easily connect with him. And so maybe I'll get you to do that yourself. So the email contact information that you had on your slide there, maybe I'll just get you to type that into the chat. But I'll get you to stop sharing your slide and then we can move over and get Michelle to get ready, or Michelle to get ready. Michelle, you are on mute. So our next presenter is Michelle Monti. There we go. Yeah, we can hear you now, Michelle. Good. Good. She's with the US CDC. I think I have that right.
Yes.
All right. I'll let you click share your screen and then you'll have to pick your which of your work on your computer there that you want to share.
I know, because I have a lot. Okay,
yeah.
But here's,
Yeah, as I was mentioning before, Michelle has been super busy, so we're really thankful for her taking some of her time out here to join us. She's been really involved with a lot of the work on COVID in the US. And so she's taking her lunch break with us, so we don't mind if you take a break every once in a while and we see you eating while other presentations are going on. All right, yeah, we can see your screen, so we will let you take it away.
The presentation? Okay, and I'll put it into the slideshow.
Yeah, looks great.
Mode. Okay, great. Look, thank you very much. Thanks for having me here today. I appreciate it. And my presentation seems to me a lot simpler than the previous two presenters, but I do appreciate the opportunity to show you what we have. I am with the CDC National Center for Environmental Health, and I am with the Environmental Health Tracking Section. And the Environmental Health Program has been around for about 10 or 11 years. And this is not just a radon program. We have 25 different content areas that include health outcomes and environmental contaminants, and radon is one of those. And we look at that data for a relationship between chronic diseases and the environment, and as we well know, radon does impact our health. So this is the tracking program is a grant-funded program. We have cooperative agreements with 25 states, and this map just shows the active states involved in this program. You don't really need any background on radon. I know that you know it, but one of the reasons why CDC is involved is because of the Healthy People 2020 and the National Radon Action Plan. And we are, the Healthy People 2020 asks agencies to promote radon testing and mitigation, and also for states that have cancer plans to include radon testing and consideration of the impact of radon on health. So the Environmental Health Tracking Program was asked to participate with EPA in looking at radon, and EPA actually asked the tracking program to create a national radon database. And so we began looking at the data and the suitability of the data for tracking back in 2011. We had a task force and we looked at this. There were some problems with the data sets were incomplete. EPA had a state and lab radon data exchange program where they identified about 56 different data variables that they would like to have in a national radon database. And we used that when we went from the radon task force to a radon pilot, where, you know, at one point we had decided that, okay, we are going to create a national radon database on the tracking program template. And so we were at work on that between 2013 and 2018, and in 2018 we were contacted by the American Association of Radon Scientists and Technologists, who said, we appreciate that you've been gathering radon data state by state, but we want to be involved and we want to assist you in updating radon data and creating different maps. So that's how we got to the point where we have two different sources of data. One are radon measurements that are supplied to us from states. The other are radon measurements supplied to us by 6 different national labs. So this is, of course, still a work in progress. These are the states that are involved in what we call our data call. And we receive data from states once a year, and usually it's in the spring. And we are in the middle of a data call right now. However, we've made that data call optional this year so that states can put their resources towards the coronavirus work. And so we may or may not be able to update these numbers next year, but I do anticipate in the spring of 2021 that we'll be, that we'll be up to date with either 2018 or 2019 or even 2020 data for radon from these states. So besides working with the states, the national labs from whom we currently have data and that we're displaying data on our portal are these 6 labs. And so let me go ahead. We have about, close to 3 million records. We have data from 2000 to 2018. However, we're only using 2005 to 2017 so that we can have consistent years of data from the different states. We're not allowed to receive data from New Jersey. They have a law in New Jersey that says radon data only goes either to the people who, the homeowner for which the test was done, or to the New Jersey Department of Environmental Protection. Kansas has asked us not to display lab data right now because they want to do some more in-depth validation of those data. So it'll be obvious when we pull up the map, and we apologize to Kansas for having it look so obvious, but we are trying to, meet their request. So then there's not enough data for Hawaii or Mississippi. Therefore, the radon data from the labs, we have enough to show for 46 states, and that's not bad. 46 out of 50 states data. Okay, the way that we display data on the tracking portal or our tracking web page is through indicators and measures, and it's a way of breaking the data down into understandable messages for that data. And so we have two different indicators because we have two different data sources, data from labs and data from states. And then the measures, I'm not going to go through all of these and bore you, but they're very similar between the states and the labs. But the major difference in the radon measures between the states and the labs is that we have enough data for the labs and enough consistent data that we can show the radon measures from the lab data over a 10-year period. And so, and I'm assuming that you'll get copies of these presentations so you can, at your leisure, go and look at some of these, look at the measures on your own. Okay. So this is a place where we could get into the tracking portal, and that we could go live and I could give you a live tour, but we never have enough time really to do something like that when I'm trying to do a presentation. So that is there for you. You can get into the tracking portal and you can look at some of these things that I'm going to show you in screenshots. So when you go to the tracking portal, it's this, and sometimes this really takes people by surprise, but please don't be. So the content is radon. We're going to look at radon tests from states here. This drop down gives you a choice of radon tests from states or radon tests from labs. Then you go to the next drop down and you look and you see what the measures are. So you have a choice of measures. You pick all counties, you can pick all years, and then you hit go and you will get your data displayed. This is radon tests from labs. Again, similar measures. And what I wanted to show you here is that we're displaying these data over 10-year periods. And so you would pick one or all of those 10-year periods, and then the program will create a map for you. And so here we have, because maximum is one of the measures that we have for a lot of our content areas. In some ways, when you show a map with maximum measures, it's really not a conversation starter, it's a conversation ender. But I'm going to show it to you anyway and show you some of the features. We can only show one map at a time on this side. We can actually show two maps side by side, but I'm just showing you one here. And in the drop down is you would switch from one 10-year period to the next by selecting that 10-year period here. When you scroll over the states and the counties in the states, because these data are displayed by county, it gives you the maximum concentration of radon and the maximum measurement of radon that was measured in that in that county. And the way the map is colored is by these three, and I noticed in somebody's question was, what is high, moderate, and low? I'm not sure if those were if that was a terminology that EPA used. We do have 3 levels, and it's greater than or equal to 4, there's a recommendation from EPA that you should mitigate your home. And if you have a measure that is 2, to less than 4, then you should consider mitigating your home. And then if you have a measure below 2, the message is that there is no safe level of radon. Exposure to radon can cause health consequences. It can cause lung cancer. So, but for most people, if they get a measurement below 2, we are wondering whether or not they would choose to mitigate and to try to get it lower than that. And so we've been told not to call this low, but to call it cautious. So there you go. And so we also create a median map. Now, median is something that public health uses a lot. So the median is the 50th percentile. So what I tell people is that 50% of the measurements in these counties were higher or lower than what you're seeing here. And it gives you a less breathtaking map than the maximum map. And again, it's the same levels. I'll point out here this hatch mark, and we use, sometimes with public health data, we suppress data, but because this is not health outcome data and it's environmental data, we're displaying it, but we're letting people know at the hash mark that there's less than 10 tests, and so the measurement for that county is not necessarily representative of that county. And so even with 10 years worth of data, we still have counties that are receiving this hash mark here. So in the next maps, and again, we have the ability on our portal to show side-by-side maps, and this is the median again, the test from labs, this is the maximum. And when this is live and you scroll over, you can do something where you connect the maps so that whatever you scroll here will show up here, except this will be median and this would be maximum. We, I see, this is, so if median and maximum is not what you're interested in looking at, but we created those maps because we were asked by industry to try to recreate what the 1970 and 1990 maps that EPA had created for the states. Those maps created by EPA were based on average radon potential, and so it was a geologic potential, and so our maps is not geologic potential, they're actual measurements of radon in air in tested homes, and it is somewhat interesting that the maps seem to follow or track the geologic potential maps, and so that's why we created the maximum and the median maps. Another way of looking at this, of course, is to look at the number and the percent of pre-mitigation radon test and post-mitigation radon test at different levels. So this map shows number of pre-mitigation radon tests that are less than 2. And the legend will show you that we have 41,131 measurements that were taken into consideration here. Let me show you the next map. It shows the percent. And so you can get a better feel for what's happening in a county if you look at the percent of pre-mitigation radon tests that were at or above 4 picocuries per liter. I noticed that you use becquerels. There is a, you can transform, or I'm not getting the word right now, but you can switch from picocuries to becquerels. You can do a calculation. Yes. Yeah. Okay. So what you can see here is as you go from light yellow to dark blue, that you have a greater percentage of pre-mitigation radon test at or above 4 picocuries per liter. So the blue is anywhere from 54 to 100%. And okay, I'm not going to get, if I go into the chat or the questions, I'll get distracted and I won't be able to finish.
Yeah, no worries. We'll do that at the end.
Okay.
And I think most people know how to convert picocuries.
Okay. All right, great.
So yeah, no worries.
Good. I know it's usually, we'll include that in a how-to guide. We will get levels of working potential as well, but we ask for picocuries per liter. So the next here, I haven't shown you much of the state radon data, and one of the things is that we encourage the states, if they're interested in having their own radon data sets, to go ahead and try to get those data from the labs. Some of our states, and this is Washington State, have a lot of radon data for their state, and they've been working on this a lot. And I've gotten the comment that, well, you only have data for 5 or 6 of the labs, and I have data for 8 of the labs. And so you can see here a difference. We're looking at number of buildings tested by year. And again, this is a number of buildings tested by year for 2017. And in the lab data that we have, there's only 334 records, but for Washington State has 577 records. And so they have a better data set in that way. And so, okay, so the next, so besides having maps, we can also display data in charts and on tables. And so if you wanted to have an exact count for a county, you could get it in the table, and we can show the charts in different ways. You can do it alphabetically, you can do it ascending or descending. And what some of the things I wanted to show you was that you can download these data. You can go to our site and you can download the data that we have displayed, and you can, I use the word play with, but you can manipulate it yourself. You can look at it, and you can do that. This is actually a picture, but there's a button here that it's this one, and if you hit that button, you can download these data. And what you'll get is you'll get the data in a comma-separated value file, which you can convert to Excel. You'll get footnotes and metadata on those data, so you'll get general information about those data. So that if you're not seeing what you want in terms of measurements, you can work with this data yourself. And so that's what it looks like when it, downloads. You can also download the map, and I'm showing you sort of a skewed view of this because I wanted you to see that we do actually have data for Alaska. And so the way that you do that is you hit this, and that will download the view that you currently have up. So for instance, this was radon tests from labs, and it's the median pre-mitigation radon level from 2008 to 2017. So if you wanted it where you're only really seeing the lower 48, you can move your view up and then ask to download that map, and then you could use that in a presentation. So we are, we're in the process of always trying to get more data from both the states and the labs. Because we're in an outbreak right now, we've had to pause that effort. But I think both the labs and the states know that we want additional data. I mentioned one of the labs here. This was the 6th lab who sent data to us, and their data is live on our website. We had assistance from one of the tracking programs, the Colorado tracking program, to receive the data from the first 5 labs that sent us data, because we needed to have a very special secure server to receive record level data from the labs. So we do receive address level data that's been geocoded, so that we can protect personally identifiable information. We have a program, we have a contract set up with Texas A&M University to geocode data from the labs, and then the labs can send that to us. And besides, even though I'm showing you county level data, what we want to do is to take that down to census tract. And we can't display those data until we get more records, because we would have all of the census tracts showing that hash mark that says less than 10 values. So our future efforts are to display census tract level data We want greater coverage of the U.S. so that we can show Texas, Hawaii, and Mississippi. And we do have lots of states that aren't involved in a cooperative agreement who are interested in sending us data, and we are working with them so that we can add them to our database. So that's all I have for now, and I guess this is the question period. Yep. So
that's great.
Go ahead.
Thanks so much, Michelle. We do have a couple questions here for you. From a health organization point of view, is it also possible to obtain data and combine numbers of diseases, people, death numbers to identify more acute regions or locations?
So the idea of collecting these data is actually to find two things. One, to facilitate public health actions where we see either counties and census tracts that have very little data. So for instance, when you get into these hash marked areas, and this is a 10-year time period, over 10 years, there ought to be more than 10 tests in that county. So the public health action that we would try to launch there is to encourage homeowners to test their home. Okay, then the second level of this would be mitigation. And so one of the things I'm not showing here right now is the percent of post mitigation radon test. And you know, as you would anticipate, we have much less post mitigation data than we do pre mitigation. So one of the things that we want to encourage is mitigation in these darker areas. So in the places where people are exposed to radon at that action level at 4 or above, the public health action we want to take is let's encourage mitigation at these places. Some states have programs where they can maybe partially fund this, or maybe there can be a tax break for this. And then your other
I think we've lost Michelle's audio for a bit. And so I'll just give her a minute to come back, unless I'm the only one.
No, you're not the only one.
Okay. All right. So Michelle, we've lost you for a minute. And I will just reach back out to her and let her know. Yeah. Oh, there we go. You're back. Good. Okay.
Oh, sorry. I didn't know I disappeared. I had gotten a message that said, do you want to trust this site?
Well, we're glad you did. It looks like we're just getting a little bit of in and out for you on your audio, but we'll move right into questions, or we'll move to the next question here. Have you seen any correlation, or is there a correlation between the map data and the propensity for homeowners to actually test or mitigate their home?
I don't know. We'd have to ask the individual states that to see. So what we would look at is an increase in post-mitigation tests from 1 year to the next, because we have a thing called Radon Awareness Month, and it's usually held in January because people spend more time in their homes in January in the States because it's colder, obviously. And so one of the things that we could encourage for the states that are involved in the Radon Task Force or the Radon Work Group is to see if they can discern an increase in mitigation based on our communication of these results. And I don't have anything that I can say, okay, that's happened. We have been getting questions from EPA about mitigation and how we're tracking mitigation, and it's just through the labs. And so another way to track that would be through radon mitigators. If we can have them be part of this and report on how many mitigations they've done, you know, and in what state and in what county. But we do see mitigation lagging way behind the screening testing.
Okay, okay. How large is a census tract versus township or town data?
It really depends on the state because, for instance, Maine has towns and they can be rather large. So a census tract is based on number of people, and I'm not really sure what is the minimum number of people to make up a census tract. Sorry about that.
Nope, no problem.
Okay.
Yeah, we can ask the questions. You don't have to answer everything.
Okay, I'll try to find out.
Okay, can you explain how the state has the data? Do they test directly, or do they purchase tests from state public health offices?
Actually, the states are getting the data the same we are getting it. The data, they're getting it from the labs. There are sometimes other tests that maybe the state sends out themselves, but for the most part, these data are all from the national testing labs. And so a state will have more records when a lab has decided not to participate in sending data to CDC.
I think that's it for
Okay.
questions.
Okay.
Yeah. And so I will get you to copy your contact information if you're okay with sharing it into the chat
Sure.
as well. I think there's a couple of people that wanted to connect with you. And then I'll move in quickly. We were also going to share, we have done this a few times in the past, but we thought we'd just do a quick share of the work that, that C-NRPP has done with mapping. So I'll move into this and then we'll take questions, a quick short question and answer, and then we will take a bit of a break, but we will come back to a discussion. So just so you know, everybody knows where we're going. So C-NRPP developed a map a few years ago. It was in conjunction with Health Canada and then also sponsored by a grant from CAREX. It was a project really that we started because really it was challenging. We were having a hard time finding any groups that were mapping it. We wanted to find a way to pool data and to start the conversation. And originally we started the conversation saying, oh, look, if you pool it, let's start a committee. And if you share your data, then you can be part of the committee. And we can start looking at all the different issues that we're finding with mapping the data. We did put together a couple qualifying things, like it must be a C-NRPP certified device. And then also, you know, we wanted to map it from the first 3 digits of the postal code, so the forward service area. We knew that obviously we wanted the start and the end dates of the radon measurement data because we wanted to be able to differentiate between a short-term and a long-term test, especially given the fact that we are focused on long-term testing in Canada. We also wanted to know if it was pre or post mitigation data. So again, we could determine whether this was, the validity of the data, as Jeffrey's talked about, and there's been some questions about. We also wanted to know where the data came from, the organization, to help us with tracking potential duplication. So we realized that there's the labs, there's retailers, there's homeowners, and so to basically identify where the detector came from so that we would be able to easily identify it was a duplicate, or sorry, a duplication, not to be mistaken or with a duplicate, which is my next point, that a quality assurance measurement. We also wanted to know if it was part of a quality assurance measurement. Obviously spiking would be no point in including those, but then also how do we deal with duplicates? And then we also wanted to identify the type of device that was being used. And a priority for us was also to protect privacy, making sure that the specific data would not be available publicly. So really the purpose of the project was to collect information, to start somewhere, to be able to have a place where we had indoor radon levels across Canada with enough variables that we'd be able to ensure a level of quality of the data, but to ensure protecting homeowner privacy. We wanted to provide a place where it could be combined with other participant data to create a cross-Canada indoor radon measurement database. And so then we started looking at the process, and really we reached out to various organizations who we knew was collecting radon measurement data, and offered the ability to be able to share the data in one database. And then again, this was the information that we asked for, was specifically wanted their data, but wanted at least these minimum points to be shared with part of our data. And then logistics of uploading was also important. So we set up a way so that organizations could upload the data but not change it. But that we would be able to change it. So if an organization realized that there was an error in some of the data, that we'd be able to go in, remove some data, or change it as need be. So we could do that from the C-NRPP side. And so we created an online sharing agreement and a secure way that they could upload their data, and that we could trace the data back to who uploaded it and the organization uploaded of the data. And we also realized that as we were starting to think about sharing the data, that we needed a specific, there was all sorts of different definitions for short and long-term testing. And we've kind of recognized this in a lot of areas. So we set definitions and said, okay, we want the start and the end date. So we really want all the data, but we would just differentiate between short and long-term tests. And so we created a definition so that we were all talking about the same thing. And so really what it rolled out to is we're looking for alpha track data and electric ion data, because those are the two long-term. We really were focused on collecting long-term data, and those are on the list. And then we created a map. So we wanted it to be simple. We also wanted to address concerns. I mentioned privacy, but also concerns that's already been talked about here, that if we were to publish some numbers, that how would people interpret the data? We didn't want them to go, oh, this is absolute. So we wanted to give some context within how much data we have, because really that's one of our major issues, is that we don't have a lot of data. And so we wanted to make that clear as well. So on the left picture here, you can see that these white lines are the dividing the map up by the FSA. So those are the various postal codes. And so more populated areas, you can see they get very small geographically, and large geographic areas exist in less densely populated areas. And so then we have started to collect data. We've found it's been really challenging to get various groups engaged. And so we have loaded the Health Canada data and the Thoron data. And then we've started to load data that radon measurement professionals have shared with us, or radon mitigation professionals. So any of the measurement data that has been done by our professionals, we've started to load that into our map. We've also loaded data that other groups have shared with us. So we have some data from BC Lung, and some data from our Take Action on Radon initiatives as well. And so you can start to see that we are getting areas that we can see, but still not a lot of tests. So this area in BC, you can see only 70 properties are tested, but we can start to show that 30% were above the 200 level. And start to see some areas that we know have really high percentage levels, and start to see some of those coming out. But we also protected areas where we don't have enough data, so it just simply gives a message of not available. So if there isn't enough data, it looks like this, that I believe we set the limit at 15. So if there's less than 15 properties tested, it just simply says that it's not available to protect the privacy. And so I'll just flip over a little bit on my screen to show you what this looks like from a live perspective. I had it open here. I think I can show it here. There. So if you go to the C-NRPP website, under the homeowner tab, you can find that it says radon map there. And then it'll take a little bit to load, but then it's just hosted here, and you can see the country is divided up into the regions. And if you click on one of the regions, then it'll bring up the levels of the data from that region. And so you can check out the data across the country. So it is publicly available. We haven't pushed it out super publicly at this point. We've just been, hosting it and using it as a conversation piece, and wanting to have a place where we start the conversation. And I think that's it. So I will actually get Erin maybe to check the chat to see if there's any questions.
Yes, so we had a question of how people can share their data. I put up the link to, because Radon professionals can share their data directly through C-NRPP by sending us, if they have a spreadsheet, that type of thing. And the public at large can share their data through Take Action on Radon. We have a share portal. They can share their data and also their radon testing story. Often there's some really compelling stories as to why people may have tested, or what sort of happened as they went down the rabbit hole of looking into radon. Another question was, can we get the data directly from labs? Which is something that we've been working on for some time. Yep. Data sharing agreements, yeah.
Yeah, we have been reaching out, and that's one of the issues we all have identified as a challenge. Oh, I skipped my challenge. My last slide was some of the challenges, and that really is one of our challenges is getting access to the data.
Another question, so the C-NRPP map will only show data from homes tested. What is the purpose of it in terms of public engagement / communication?
Right, so we've been focused on residential testing at this point. One of it is really to identify the fact that there is a lack of tests across in various areas. So we are seeing that an increase in testing in some areas, but when we start to look at the number of dwellings in that region, it's still a fraction of a %. And so really one of the conversations we wanted to use the data for was to reach out to municipalities where we identify that there is, a potential. We go, hey, that we are starting to see that there is some issues in your area, but where we're still seeing such a small percentage of testing done.
Mm-hmm. We got a question. What quantity of data do we have in that database? Do we have a total count on points, Pam?
Not off the top of my head, sorry, no.
Order of magnitude, tens of thousands, because
yeah,
you do have
well, the Health
Canada
data, I believe, is about 14,000 data points, right, Michelle? So there should
be. It's about that, yeah.
Yeah. So I think
that's probably what you have, yeah.
Yeah, that certainly is the majority of the data points. The Thoron study wasn't nearly as many.
That's a few more thousand,
yeah. Yeah.
A question: as labs are often in other countries, does this pose a problem?
I can't think of why. I suppose, I guess it does. It has complicated things a little bit with legal issues. Just what legal grounds do we take? And so that's a question that I kind of bring to the discussion, as well as just willingness to share. It certainly does differ among labs whether or not they're willing to share with us.
And then a question from Rashini: how will we make sure that all the maps being produced will be consistent? I'm wondering about confusing the public.
Yeah, and that's certainly one of our discussions. So I think we can take that question again to our common discussion.
Yeah, and Michael chiming in. I think that's it as far as questions go.
Yeah, okay. Well, there's still more time to ask questions, and so we will take a short break Before we do, though, we do have a couple important announcements. And so I will just quickly share my screen again. And so we've got the announcement about our Radon Olympics. So we do have a video contest. You've seen some of our examples if you've been part of our CARST online conference so far. But we want to see your examples. So take a video and send us your video, and we will post them online. And we do have medals for those who are participating. So not to keep you in suspense any longer, we do have our video for our Radon Olympic event for today. So I will, oops, I forgot to share my audio. Hold on, I'll try that again. Here is our Olympic event for the day. It would not be the Radon conference without a little bit of silliness and fun.
Welcome to today's Radon Olympic event. Today's Radon Olympic event are trefoil jacks. The key to this event is the trefoil is 3 points. Remember, safety first. If you're on a slippery floor, make sure you take off your socks. Here it is.
All right, there's my attempt to look like a radiation symbol. So, you know, don't leave me hanging out there. Don't let me be the only one being a fool of myself. And everybody take some time to have a little fun in these times of working from home. Get up, move around, and show us some of your own Radon Olympic events from home. Okay, so we will take a 2 or 3 minute break, give the presenters a chance just to relax for a minute before we go back into some deeper discussions, and also everybody come back for in about 3 minutes, and I'll put a slideshow on the screen of some pictures to entertain you while you wait. So, all right, welcome back. So I'll let some of those panelists join us and get to everybody back again. Just a little bit of how I thought we would work this. I think we'll start with the panelists. We wanted to have a discussion about some of the challenges and some thoughts going forward, but really we wanted to get a lot of feedback from the people, from everybody else. We, as a group, have started the conversation and we'll continue this conversation, but really this is an opportunity for those of you who are attendees to be able to jump in and share some of your thoughts on mapping, share some of your concerns, some of your excitements with this going on, and that sort of thing. So I'll maybe just open it up first to some of the panelists to share any questions that you're curious that you would like to, or feedback that you're looking for from our group as a whole, and then we'll start to identify a few topics as we go into discussion. So I'll start with there, and while you guys are thinking, we'll take it for a few minutes with the format the way we are, but then I'll introduce a couple more of our attendees who are involved with mapping and bring them into the discussion, and then eventually we'll bring everybody into audio so we can have an online audio discussion, and we'll see how it goes with 70 of us on the line. All right, anybody have any thoughts of any panelists here?
I'll just start by saying it's great to see and hear other work that's being done in Canada as well as down in the States, and particularly for Michelle's presentation. Hopefully that's something we can get to, of data integrated at that level and of that quantity.
Great, thanks, Jeff. I know a couple of questions that we've been talking about that were talked about was post mitigation. I think that's a really interesting discussion point. We're kind of launching mapping from the start, and so we have, I guess we've already talked a bit about how do we coordinate, how do we not confuse people and sort of have maps that work together rather than say different things and are confusing to people. But this is a great example of when it would be good to have some differentiation. So can we collect data on pre-mitigation data and then also have a way to collect data on post-mitigation data? That would just be amazing to be able to flip from one map to another and see how many houses are being mitigated. Have any of our mappers on the line, have you given any thought to what that might look like?
I can just say on my end, I totally agree. That's a very important factor to consider. In some of the contributions we've been getting to date, that is clear. In other cases, it's unclear whether this particular observation is a pre or post mitigation. If it is clear, then it's something we would obviously indicate. But unfortunately, in some data subsets, it's not indicated. So we unfortunately wouldn't be able to make, let's say we're producing a map and say, hey, this is pre, this is post.
Yeah.
Yeah, I agree. It's very important because, well, it's mostly the pre that we're interested in. If you look at, if you want to talk about potential and risk, I mean, it's nice to see that the post mitigation works, but, and that's one of the concerns we have. I mean, at Health Canada, I mean, we have a full control of the data we have. We collected it ourselves, and now we are wondering, well, what we will be able to do with data we would get from private labs. Because if you have no indication if it's pre or post mitigation, maybe it's not clear how you can use that data combined with the other data set that we have. Maybe you have to use it, but with a weighting factor because of the uncertainty, because there's still information in there, but it's not clear to me how do you integrate and process that type of data if you don't have the information about pre or post mitigation. So it's a concern for us, but it doesn't mean that we shouldn't be looking into how, and it doesn't mean that we should not be collecting data from all the sources. That's something that we can figure out during or after the process.
Yeah, I just want to mention that that's one of the benefits of having a centralized database, is that all of is that if you have a centralized database and then you let researchers access it, they're all using the same data set to come up with these final models or products or whatever it is. Because really the inputs really affect what the output is. And so if all the inputs are different, you're going to have slightly different outputs. And the other thing too is that each organization is creating these products for their own purpose. So for Health Canada, we're doing it specifically for policy recommendations. And anything that we do post to the public is most likely not something modeled, but something like what C-NRPP's doing and just reporting the data that they have. And the other thing too is that if we're all using sound science, they should all coalesce more or less the same. Yeah, that's all I have to say.
Okay. I have, I know Jean-Philippe Drouat, oh, I think I've screwed up your last name, Jean-Philippe, sorry, is on the line. I was just checking to see if he's interested in joining in the discussion. He's done some mapping work in Quebec. And then also John Drage, he was going to join us as well. So it might be interesting to get his perspective. He's been doing some mapping in Nova Scotia as well. But John, I can't identify with who you are. So if you're interested in joining right away in the discussion, maybe put your hand up on on your dashboard, and then I'll know who you are and can add you into this discussion. But there's a couple other points that have kind of come up in some of the questions in general. And this issue of how do we encourage people to keep testing if there is a low, if it looks like there's low numbers in an area, but really even if there's 2% of the homes in one area have high levels, everybody who hasn't yet tested still needs to be tested. So how do we create a map where we're still having that, being able to have that discussion with people in that area?
So,
Well, go ahead.
Go ahead.
First thing I would say, sorry, is that you don't want to. It's all about wording and colors also. I mean, if you categorize a zone as being good or doing well, for sure people will think that they are fine. But for example, this is the reason why we use in our current map only red shades, saying that it's never. You always have to test. It's just some regions are better than others. So I think it's a lot of messaging there and choices that you can make. Words and colors are important here.
One of the things that we do when we talk about messaging, I see that that's in the chat, but I only showed you our portal where we access data. We have, for people who aren't interested in just looking at data, lots of information about how you can't tell what your home measurement is going to be. You need to test. And just because there's a median or there's a geologic potential map that says it might be low, you don't know. And so the message from CDC is always know your numbers, test your home. And one of the ways to try to facilitate that is to get counties or states to have a campaign, have a testing campaign, and reach out to those census tracts or counties that have low testing and see if you can get, a greater percentage of testing done. But really, that's always the big problem. So as we try to get communication products out, asking people to test their home, having radon awareness months, talking about the link between radon exposure and cancer, it's, in the end, you're always having to rely on people to take this action themselves. But, we can try and message and communicate it.
Yeah. Okay. I will take a minute just to introduce Jean-Philippe. He's joined us on the video. So welcome, Jean-Philippe. Do you want to just share briefly some of the work you've done? I think it was part of your PhD work, right, that you were doing mapping?
Yes, during my PhD, I produced the radon potential map in the province of Quebec. We use the geological and radiogeochemical data to map the radon potential in the province of Quebec. So we use the indoor radon data, geological surveys, geochemical and radiogeochemical surveys to produce our maps. And we published these maps in scientific papers in 2013, 15, and 16.
Right. Yeah, and I think they're still publicly available, right?
Yeah, they're public.
Okay. Good. Well, welcome. So, Jean-Philippe, I don't know if you had any thoughts on some of the questions we've been discussing so far. Just the first one was showing pre and post mitigation, and then the other is ensuring that we still are encouraging testing.
Yeah, my first thoughts was I typed it in the chat. It's the fact that we need to have, I think we need to have a robust methodology that we will have to use. We cannot have multiple methodologies and produce multiple maps. I think we need to define a specific methodology to use. And that's what I think we need to define today, or in the few days, weeks. We have to define a robust methodology that we will use to produce a map. We cannot have multiple maps.
Right. Okay. Your audio is just a little bit spotty or something, Jean-Philippe. But yeah, I think it's been kind of brought out a couple of times to make sure that we've got consistency or collaboration among our mapping data that's ongoing. Michelle, Colin, and Jeff, I don't know, do you guys have thoughts on that? How do we all work together? I mean, I guess really one is this: we've started a working group, so that's sort of how we've started. Any other thoughts that you want to talk about, kind of ensuring our maps are consistent?
Yeah, I want to say I think it is important to have some sort of standard in maybe what we consider high, medium, low. But in terms of developing methodology that is consistent across Canada, consistent between institutions, I think that's a really high bar and also unrealistic, to be honest, just because for Health Canada, we're concerned at the national scale, and for a province, they would only be concerned at their scale, and they would have a lot more maneuverability within their own jurisdiction to do that. Yeah.
If the maps are also published in peer-reviewed articles, in that article, it would describe the methodology as well. So that's just another thing to consider, is that if there are different radon potential maps, and we do see large differences, I think we have to kind of skim over the fact that obviously there would be small differences given differences in methodology or data sources. Excuse me. But if we do see the methodology behind it, then we can surmise those differences. But to build off what Pam was saying, yeah, I think like starting with groups and efforts like this, where we are aware of, excuse me, what other folks are doing and can engage them at the appropriate points.
Great.
And do you think it would be possible for like Health Canada to lead a project like Michel Monti presented, a national project to map all Canada, the radon potential in all Canada? I suggest Health Canada, but it can be C-NRPP, I don't know.
Yeah, we've discussed with Pam about doing some sort of centralized radon database, whether it would be housed with Health Canada or C-NRPP. So that is in the early talks to try and develop something centralized rather than just having people send us information that we use for our own personal internal projects. But having said that, that's in early discussions for posting third-party information. For our own information, we've already posted everything we have at the national level at FSA or Health Region.
Yeah, I think one of the issues and one of the reasons we wanted to all talk together is to talk about capabilities, limitations, and of all these different organizations, to see really what is the vision for mapping and which organization has the capability without the limitations to be able to help move it forward. Because we all have some of those.
And also, I think there's two things. Oh, sorry. There's two things you do with the data, and it's hard to make sure that everybody wants to do the same thing. As you can have the raw data and communicate it. That's it. So we can all agree on how do you bin that data and how you communicate it. But there's also, if you want to fill gaps, there's many different approaches that can be taken, and it can depend on the purpose you are trying to achieve here. So I see this twofold, yeah. Communicating the data you have and filling the gaps that you have. So, and maybe we can agree on a national approach, but it's not trivial, I think.
At CDC, our national approach for tracking, we refer to our data as nationally consistent data and measures, because unless it's nationally consistent, then we cannot show, a map of the United States with data from different states that come from different data sources or put together from different data variables. So the tools, we've spent years in conversation with all the different players, on the phone and on webinars, talking about what are the data variables that we want to include and what will we accept. And then we have a rigorous data validation, and we have a contractor that assists us with this data validation, and we look at every record. And so if there's something that doesn't meet that nationally consistent data and measure place, then it gets thrown out. And so it's, we have a mechanism where we can talk about this. So it would be, do you want to get the state or the provinces in Canada that are already working on radon and sit down at the table like you are here and look at your different data variables, your different data sets, whether you want this to be radon in air or geologic potential, or whether you want to map those on different maps. But I kept getting the same question over and over when we were getting data from states and we were getting from labs is, how are you going to not duplicate? And it's easy. We're not combining these things. It's not a bag. We don't take the data in and everything goes in one bag. We keep it separate. We know the data from different years, different states, and different data sets. So I think you can do it. And I could share my data dictionary and how-to guide with you.
Yeah, excellent. Actually, that's a good transition into two questions that I have for you, Michelle. Have you compared your measurement maps to older potential maps?
Well, our current maps are radon and air measurements, and the older maps are geologic potential. And so we haven't laid them on top of each other because the maps on tracking are dynamic. So when we go in, the only time when they're non-dynamic is when I take a screenshot and show it to you. But when you go into our portal and you ask for a certain content and indicator and measure, it's created there. Something goes in and pulls this information off of our server and creates the map right there. So we don't have the geologic potential data that we could actually put on a server and form that, but there has got to be some kind of modeling effort or whatever where we could put a geologic potential layer on top of that. I can ask for that to be done, but just looking at these things, looking at a map of the say the 1970 or 1990 geologic potential, and then looking at, and then you would have to select. The geologic potential map is a mean. And so if we did a mean of the measurements in air, then it's like, okay, what year do you use, or what combination of years? And we think a 10-year combined data set is a good amount of time. And so do you use your most recent? Do you use, do you use an older 10 year? But just eyeballing it, it looks, it looks like they track, because obviously the geology is what.
Yeah. Do you have any, are you tracking at all radon in water testing?
We're not. We do know that some in EPA are looking at that. There was I think there's a conference coming up where they're looking at that. This effort right now is just radon in air, because we've been told that that is the main exposure in terms of getting lung cancer. Now we could, I also work on drinking water, and when we were looking at contaminants, we looked to see if we could get radon, and that data was not very available. So we do get measurements of uranium and radium in drinking water. Okay. But we haven't combined it with this. We could look at that.
So that, I'm going to throw that out to the other panelists. Have you thought about including measurements, or a way to include measurements from radon in water testing?
If there is that data to be shared in our BC repository, sure. To my understanding, there's not a lot, particularly with the contributors we've discussed to date. And if it were to be included, of course, indicated as such.
Okay. Yeah, I think that's a big problem in Canada. We don't have a lot of data on radon in water.
Yeah, I know in the province of Quebec, we have a few radon measurement in water, but we do not have a lot.
Yeah.
Yeah, I know that we have a couple. No, we have one region, Quebec actually, who's doing a study on radon water. But for the most part, from research done at the Bureau here, I think we found that it's kind of negligible, and that our messaging's always been treat the air before your water.
There also is a discussion on engaging with the provinces, and Michelle brought this up in her point a few points ago. But this, I think, is a real challenge for us in Canada, that we don't have great engagement at the provincial level across the country. Anybody have any thoughts about this?
I saw somebody mentioned Health Canada. Is it possible that they could be the umbrella, or CARST would be the umbrella and bringing the different provinces together?
Yeah, I think it's a challenge that we identify. I mean, Jean-Philippe, can you give us any advice from, being able to engage in Quebec?
Pardon, can you repeat the question?
Just trying to engage at the provincial level. I mean, we sort of, so to speak, luck out with you because you chose to do this as part of your PhD study. Really, it was a personal engagement that got you involved, I'm assuming?
Yeah, it was really time consuming. I work on radon mapping, it was almost 10-year challenge. It took like 5 or 6 years to map the radon potential map, but finally we have a robust methodology that we can use, and I already discussed with Aaron Godarzi from Evic Radon and the University of Calgary of potential methodology that we can use our previous methodology that I use in my PhD and refine it with like a machine learning method or something like this. We would like to add some criteria to the methodology, the simple geologic methodology that I used in my PhD. But it's a big challenge that we would like to achieve in Canada. I think it's possible, but it will take some time for sure.
Yeah. Right. And I think that identifying, engaging at provincial level is important. I think that's something that we, just need to start digging into and looking at the right people and identifying across the country how to work with them. There's been lots of ideas and chatter, which is great, on ways to identify the maps. So making sure there's clear methodology listed on the map and mark some of the issues. The other question I had for discussion was about the fact that radon levels can change. And I'm wondering if anybody has thought about this with respect to their radon levels. So if I tested today my home, in fact, I mean, this is my own situation. I tested my house right after I moved in. It's not a brand new house, for those who are wondering if it's a new construction issue. But I moved in and I had an annual or a long-term test of 150, and then about 2 years later I tested again, and I was up on a long-term test at over 300. So radon levels can change, and how do we deal with this if we create a map based on one measurement per house?
Try to encourage people to test more often. Now, I know that's wishful thinking when we have places or counties over a 10-year period that have less than 10 tests. But as we communicate the issue and the importance of it, which is, lung cancer risk, we can also encourage people to test their homes. Now, the thing is that people move around in their homes a lot here. I'm not sure if that's the same in Canada. And so when people buy a new home, you can encourage them to get the home tested before they purchase the home. And there was another incident. There was an earthquake in Alaska a few years ago, and Alaska participates in our radon work group, and one of the things they were trying to do was to get support for telling people that after an earthquake they need to retest their home because things can shift. And so it's after, say, major events like that, or at least, every few years, if you haven't retested your home, to just retest your home. The other thing is like when you tested your home. So there is something of a seasonality, and we don't break that out because we don't have enough tests to begin with. But say if the first time you tested your home was in January and the next time you tested in June or July, you might anticipate getting a different result.
Any other panelists want to jump in on this thought?
Yeah, I agree, and I think it overall underpins the value of aggregating as much as possible, just accounting for that variability, right? This is no different from many other types of data. If you think about, if you measure your blood pressure, your heart rate, it vary over time, vary between people, right? So if you want as representative of a value as possible, whatever that representative value is, whether it's a mean, a percentile, as much data within one particular building or within as many buildings as possible in a given area.
And importantly, they should be long-term.
Yeah, for sure.
Measurements, we have to be careful about that.
Yeah, for sure.
But that helps. But for sure, it's not there's no easy solution here. We need more data, but sometimes it's hard to get only one data point. So it's a very good question with a very not clear.
And another, so Michelle Monti, in Canada, we use long-term testing. And so this opens up the question of testing. So we don't typically have the same amount of testing during real estate transactions and the short-term testing. So it's not, the testing isn't occurring the same in Canada as it is in the US. And so we're looking at collecting the long-term radon test But we have heard from a lot of real estate agents that they would really be interested in a database. So in certain jurisdictions, there is a database like oil drums that are in the ground. So they can go and they can check a database when they're looking at a listing to see if it's on a specific list about a specific issue. And so there was some interest when we talked with a number of real estate agents to say, look, could there be a similar thing for radon that they could go and see whether this house has been tested. Any comments, any thoughts on that?
I mean, I guess it depends if you would be allowed to have that information publicly available. Because when you put data next to an address, then you have, private information there. So it depends on your rules there. Like in some of our states, any data collected is available to the public. And in other states, for instance, in New Jersey, you would never see the result of a test, only the homeowner. So we do use short-term test results. We have those. And we also have the real estate transaction results, those continuous radon monitoring, where they put a machine in the house and they collect for 3 or 5 days. And it's results are calculated on an ongoing basis, and then they have hourly results, and then they have a final calculated result from that. It's considered, good data. It's not long, as long as a long-term test that you might, conduct in your home over 9 months or however long. How long are your long-term tests?
90 days.
Yeah, 91 days or longer. Which, although, like I think Colin jumped in with 90 days, so that's part of the definition. It's 3 months. Is it 90 days? Is it 91? Which 3 months? And so, yeah, Jeffrey, maybe, did you have any thoughts you want to talk about this one?
Yeah, I mean, I see the value of what you're describing. I just did see a comment pop up in the chat that I was saying, like, if they're interested in knowing the radon level in that house, the realtor at the point of sale, then hey, just test it, right? Certainly agree with that, and kind of double down on what we were describing earlier, just trying to get as much information as possible, both from the homeowner's perspective, but also from this like broader research mapping perspective. For the scope of, or for our work in particular, as I mentioned, this isn't something we are interested in. It's kind of just trying to have that balance of what we could reasonably do, or what contributors reasonably could have. If we were limiting our scope to that, we want to really, like, let's just say we wanted to have this registry of, like, homeowner, address, radon level. I don't think we would get many contributors, because there's a lot more concern about sharing data in that sense. Now, if we're doing it a lot more anonymized and de-identified, as we are, as I was describing in my presentation, I think that's when we can get a lot of contributors, and then they'll start to build some inferences from there. So it's kind of that balance and think about where we want to go going forward.
The question about real estate is tricky. It's something that in talking with a lot of agents, I know there's some comments in the chat as well about discussing with the agents. It is certainly something we've seen, which is partly why CARST developed the guideline. We know in the US that there is a standard for real estate transactions, and we don't follow it here in Canada because we want the focus to be on long-term testing, the decision for mitigation. So that's all the thought that went into the CARST real estate guidelines, so that we could provide the real estate agents who are asking for it to protect their buyers and be able to give them some information at the point of sale of potential, because they felt like they were walking into houses blind and didn't know how to advise their homeowners. But really it's intended to follow up with a long-term test, so that the decision is based on a long-term test for mitigation, and to especially for protecting public health, to make sure any low levels are retested. But the question about the legal, is there privacy with the radon test? So I know NOAA has talked about this or looked into this, sorry, and and there are different examples across the country of data that we do publicize about homes. And so it isn't necessarily considered privacy information. So our health data is considered privacy. Our emails are considered privacy. You know, so there are certain things that we do consider private data. And I know Noah has questioned that radon levels within homes shouldn't be considered private data. Anybody want to talk about that?
All I can say is from our perspective for our particular project, when we're just starting to build this repository, we're not really thinking too much about it because we want to get this thing going. And like I said, we just want to get as much contributors as possible. As I was saying in my last response, you know, we want to say we're looking at all this information because we.
Your audio is starting to loop.
Yeah, we didn't hear anything.
Yeah. You want to
okay.
try again, Jeff?
Yeah, should I just try everything again?
Yeah.
Yeah, I was just saying, am I good now? I see some nods. All right, so just shake your head if I start to cut out again. But I was just saying, can't really comment too much on the legalities of it. I would lean on Noah for that. For the purposes of our project, we're just trying to and do some.
No.
Oh.
Good. Okay. Well.
How's this? Is this better?
We'll try it.
Yeah, it's good.
Yeah, I just took my headphones out, so I'm just talking to my laptop now. Start from the beginning there.
Yeah.
Yeah. So I was just saying, I would lean on Noah to talk more about the legalities of the issue from the perspective of our project. Where we're going, engage as many partners as possible. Like I was saying before, we are saying at the get-go, hey, we actually don't think this is personal information, so we won't collect it. Oh, I'm out.
Yeah, for some reason it just came in. Sounds good.
I'll type my response.
Well, and I don't know that we have the answer right now. I think it is something we need to dig in legally, but I'm curious on opinion. Anybody thought about privacy? I know we've talked about this from the perspective, even if it's not considered legally private information, it's still the homeowner's perspective, and we don't want to create fear for people to test. So I think that's another thing that maybe we can talk about.
One thing I would like to ask is radon measurements owned by private company like Airthings, are they available for project or research project? Are these measurements available for research project, or do we need to have an agreement with these private companies?
Yeah, I think that's a good question. I think that's something that we need to explore. I think we would need an agreement with them, and also, but you know, the data is, they have made their data publicly available.
Okay.
Yeah, we would need an agreement with them for sure. And again, yeah, what type? Yeah, you need to know which detector they were using. I mean, because they have a. It's not clear if you get enough information about these devices that are low cost and they can move around from one house to another too. So they have real-time measurement as well. It will be interesting, but again, can we rely on, is this reliable? Is it something that, it's one thing to get the data, can you really use it? That's another thing.
Yeah, the validity of the data again is in question. I'm not, so Noah has given some clarification. So he just clarified that the issue with privacy is because radon would be considered a latent defect. So it's different than considering whether it's private or not, as far as coming under personal protection or personal information privacy legislation. But the fact that radon, so a latent defect would be something in a home that you can't easily identify by touring or doing a walk around of the house. So radon, because the only way you would know the radon levels is to test, you can't see it, smell it, taste it, as we often say. You can't look at the roof, or you can look at the roof and see whether it looks in good shape, but then you can also ask for the age and get in a sense there. But there's really nothing that you can do other than getting test data for radon. So that's why it's considered a latent defect. And so I think a number of provinces do have a policy that once it's been tested, it should be disclosed. And I know Ontario has that as well. All right. So I'm just going to read out Jeff's answer. Yeah, he's leaning on NOAA for the legalities of the issue, but from his perspective, we're trying to get this provincially central repository going. We feel like if we were to say radon isn't personal information and we're looking to publish this, then in a line listed manner, we won't get many contributors and we won't have a useful central repository. Yeah, so public perception is certainly an important part of getting the data and pooling it. All right, any other questions or thoughts that I've missed in the discussion? One person said that they think federal law makes a home your castle, and so therefore you own the data, and I'm not sure. We can definitely look more into that. One more question, Michelle, for you, Michelle Moti. Is the US CDC data used to correlate with lung cancer data?
We will be using it in different ways. We looked at attributable risk. There's been a long-term estimate of 21,000 lung cancer deaths a year from radon exposure. So I asked our cancer division, could we relook at that? I mean, is that attributable risk the same? Are people, mitigating more? And they did a back of the envelope evaluation and said it's about the same. It's like it came up as 21,800. But what we want to do is we want to look more closely. We want to get better population data, and why we want to go from county to census tract is that you can use the measurements at the census tract with the cancer data to get a better idea of what kind of a problem is exposure to radon in these areas. So we are working with our cancer division at CDC. We want to hone in on the data a little bit better. So we're not going to use the entire data set we have. We want to use data sets from states so that the analysis would be maybe 4 or 5 states that have really good in-depth, long-term radon measurements, and then looking at the cancer data that we have and comparing there. So it's in the works. It's not done by any means, but we do intend to have some studies on that. So it wouldn't necessarily be in a map, but it would be, say, in a journal article.
Okay, great. All right, well, any other thoughts? So what I thought I would do is transition as part of our CARST conference and just wanting a feel of networking, that I would transition from our presentation mode and let people join in audibly. But I'll let the panelists decide whether you want to stick around or you can feel free to go. This is sort of our time limit that I asked you to be part. But before I do that, any last minute thoughts that any of the panelists want to contribute? No, you're all good? Good, all right.
I'll say if I'm able to.
Yeah, we can hear you so far. I did hear one suggestion was to talk a little bit more slowly.
I apologize. I have a tendency to speak fast in general. On the note of collaboration we're talking about earlier, I think one thing we can look at is big picture. Radon is a niche issue, and there's not that many parties involved, whether there's government or research groups. So I think that's something we can think about when it comes to collaboration. And building on what Colin presented on and what Michelle said earlier, there's many different ways to model radon, to map radon. And yes, of course, at the point of communication, it's It's important to have consistent communication, have that adjunct messaging. It's important to test your own home. And this is just a guide or a reference or forecasting tool. But I think there's scientific value in have not necessarily competing methodologies, but different methodologies, because that's how we learn, right? I'll just end with that. And did that all go through?
It did, yeah, and very insightful, Jeffrey. I really appreciate that. Yeah, it's very excellent. Oh, and Roshini too. I will say there's been lots of comments as well. I haven't read out them all, but just thanks for all of you. Really great information. You guys are doing a great job. And so I will take now as my time just to thank each one of you for taking the time today to join us, to present the information. And I am looking forward. This is something that we're going to start digging into. And so looking forward to where we can go and having a re-discussion of this, a reboot, so to speak, and see where we've gone over the last year. Hopefully in Victoria or whenever we can meet together.
Thank you.
Yeah, great. Good. We don't have all the answers. That's right. I just see John is chatting in. We don't have all the answers, but we want to keep the discussion going and hopefully we will just improve things. Good. All right. Well, I will transition now and let anybody who wants to chat and stick around, you're free to go. No need to, but I will open up the chat lines in case anybody wants to just chit chat and be part of the networking that we typically have at the CARST conference.
Thank you, Pam. Thank you.
Yeah, thanks, Jean-Philippe, for being able to just join in quickly with us.
Thank you. It's been great. I'm going to have to
for sure
get back to my Corona work.
Yeah.
You can email me. Okay.
Sounds good. Thanks so much, Michelle.
All right. Bye-bye.
Michelle.
Bye.
Bye.
I can stick around a little bit for the discussion, but we'll have to run shortly for the meeting and other commitments.
Yeah, sounds good. I was going to say I was going to just open this up for 15 minutes and then I will close it all. All right, so most of you are open. I'm going through the list here and just making sure. You can mute or unmute yourself. So, I mean, any topic is available. Oh, there was a good point. Links to Jean-Philippe's information. I know I've had those at one point. Maybe Jean-Philippe, would you be able to provide us links to your reports?
Yeah, I can share my reports.
Okay, and then we can follow that up.
Yeah, for sure. I will do this in a few minutes.
Okay.
Can people hear me?
Yes.
It's Anne-Marie.
Yeah.
So thank you to everyone. I had a question just in general for Canada. I mean, I'm so impressed by what the US CDC can do, and I recognize that we're nowhere near there yet. But I just wondered, for those of you who are using geologic measurements, how much are you seeing that adds to your mapping beyond just the indoor air readings? Or is that too hard to answer?
I can answer specifically for what I presented on today. When we were looking at Saskatchewan and developing this indoor radon measurement based model, I compared it to the methodology that was used. So I transferred the methodology from the Ontario geology to Saskatchewan to try and replicate that in Saskatchewan, and then I compared various methods and always brought it back to the geology. And every time the indoor measurement model was more conservative, it always found less false negatives, but it never really increased that false positive too much. So that's one reason why we also decided to move to this indoor radon model, just because we're coming from a health perspective and we want to be as conservative as possible.
So by conservative, do you mean the indoor tests were lower than you would have predicted with the geologic potential?
They were higher than they would have been predicted with the geologic potential.
Oh, that's interesting. Jean-Philippe, is that also, I'm assuming you were using geologic or bedrock concentrations if you're using uranium. Do you have a similar finding then as Colin?
In some areas, yes, we were underestimated, but in some areas we were overestimated. So it depends on the geology. You have an idea of whether the specific geology is supposed to produce radon, but it is not 100% sure. So it's an hypothesis. But yes, we, like Colin said, in most of the data, in most of the areas, we had underestimated the radon concentration.
That's interesting. I often hear critiques that those geologic potential maps overestimate the radon concentrations and ergo overestimate the risk, and somehow they're scaring people. So it's interesting to hear that that may not actually be the case.
I think
one thing too
Anne-Marie,
is,
I think that's why you've got to, the message on those maps has to be very clear. They're a probability map to provide a relative picture of where you might find or likely to find high levels of radon, but they're not absolute, they can't be. And for all the reasons that you folks are just saying now, there's so many factors that influence radon moving from the ground into a house or an indoor environment that a map can't, there's no map that will ever be able to sort of cover that. So the messaging is so important. It really is. I can't emphasize that enough. And as you know, we developed the first and only geologic national map of Canada many years ago. So it's an indicator. It's a picture. But it's not guaranteed. It's not absolute. And everybody has to test. And I think you've just got to keep repeating that. I think it's great to build up a national map that combines all the different parameters that influence radon. I think that's still a good objective, a good goal, but you're never going to have a picture that you can count on. It's still going to require testing. As we've said, the radon level changes throughout the day, and it certainly can change house to house or building to building. So I don't think you'll ever get away from having to test to be certain. Like I said, a map's a good indicator, but nothing more.
Yeah, I agree with what Alan just said. I measured radon concentration in my house, and in days to days it was varying. So it's impossible to predict the exact concentration of radon in a specific house. It's impossible. It's just a model that. Are you more prone to have high radon concentration or less prone? But it's impossible to predict the exact concentration.
Hmm.
Yeah. I'll just add that in the messaging, I think it's important for us to all remember that we use forecasting tools all the time. Just for example, you may go to the doctor, you present with certain symptoms, and given your, demographics, that doesn't show for certain you do have, say, a certain disease, not until you test it. But those predictive factors are important. Ultimately, they're tools. And yeah, again, with what everyone else is saying, it's just the messaging of that is very important. But just realizing, hey, we use tools all the time to help us guide our decisions. It's no different.
Yeah, no, well said, Jeff.
Yeah, that's a good point, Jeff. I mean, Michelle Monti's group, there's hundreds of exposures. Radon is just but one of the things the environmental health tracking program actually follows. They do air pollution and water contaminants. So radon is just a fleet of things that they're tracking and modeling.
Hi, this is Kelly. And it's funny, I think what the CDC is doing is amazing, but to me, my first thought was, when I started seeing those images, was this is going to be confusing to the public, like all the different varieties of maps that they can look at, and what's the difference between the states and the labs, et cetera. So I can see the value in that from a research perspective, from a policy perspective, but from a public facing perspective, I wonder how much it's used that way. But B, I think it can be confusing. But I wanted to comment on the question earlier about connecting with the provinces and territories and Health Canada's role in that. So, and I'm throwing it out there, Michelle, and I'd love your thought and yours too, Colin. We do have a federal, provincial, territorial committee. I don't think the people that sit on that committee are the right people from a mapping perspective, but we could always bring it up with them. We do meet with them on an annual basis. But I think I've always understood our role as Health Canada related to mapping was to develop, do research related to methodology to be able to provide guidance and support to provinces and territories or jurisdictional authorities that want to develop maps, and encourage them to be consistent in their approach and use the methodologies that we're using and provide support for them to do that, but not to develop all of these maps for them necessarily, but to support them. I think there's also a thought of developing some of these maps to help them make policy decisions with work that we're doing. But I don't know that it's our role, because I saw some comments about, you know, develop a map and put it out there for the province. I think that's beyond what we should be doing. I think really it should be more of a collaboration. That's sort of my thought process. But what are your thoughts, Michelle and Colin?
Well, yeah, that's a very complex question. Yeah, what's exactly our role here? How far we should go with the map? For sure, we should offer something that is homogeneous, and that's why Colin mentioned that we need a method that is good for the whole country and provide and support them with the tools and all the data we have, or centralize the data with C-NRPP or with us, as long as it's available, and we can share our methodology. But it's not clear to me exactly how we can engage them and how we should support them.
Yeah. And I don't want to sound like I'm contradicting what I've asked you to do in the past, Colin, because I know I've asked you to develop maps for provinces and territories and municipalities to use as an engagement tool, right? But I think we can do that using our methodology and using the data that we have, but we can't label that the province's map. That's I think going beyond what we should be doing, but we can certainly say we've mapped the data that we have, the geology information that we have, using the methodology that we have to give you a picture of what we think the issue is within your province, territory, municipality, to help you make a decision on how you prioritize this from a public health perspective, from a labor or occupational health perspective, from a real estate perspective, et cetera, et cetera.
Yeah, that's kind of how I view it a little bit too, is that our efforts are for our policy and our products and our stakeholders, and that anything that we put out there is a supportive role, like how we release all of our information, and the maps that we have released to the public is really just a visual representation of the data that's already out there in the interwebs.
Although we try to go a little bit deeper with modeling, it's a step further also to try to fill the gap. And but for sure, I agree with Colin. I mean that the first goal is to try to communicate the data we have and that is available, so we enable them to use it. Now we're trying also to do a little bit more work and filling gaps, and that's why probably we have this conversation now also, because there's many ways to do that.
Yeah, and I just want to emphasize too that Health Canada looks at this as a national problem, and we don't have the agility that provinces and municipalities might have. And so when we look at a region, we're usually looking at health regions or maybe postal code at the most, at the largest scale. whereas municipalities or provinces can be a lot more precise in what they're doing.
It's Anne-Marie. Just to follow up on that point, Colin and the panelists, there's very little appetite outside of provinces such as Nova Scotia to actually, and maybe Quebec, to do much mapping. There's neither funding for radon testing, nor is there any incentive provincially for people to do anything. So we're kind of at a catch-22. I liked Kelly's idea of the FPT because it might actually spur a bit more interest in doing this on some of those provinces like Saskatchewan and Manitoba that really have not, even though there's data available, have not taken on mapping in any particular way.
Yeah, I noticed Jean D'Alberta put a comment in the chat about the, some question about provincial. Can the provinces reach out to the federal government? But the problem we're having is that we're having trouble engaging with the provinces. And so a follow-up point to that is, who is responsible for the lung cancer dollars that is funding the health? And so I do believe that health is funded provincially in our country. So that certainly is something that the provinces should be paying attention to.
I agree.
I think, Pam, it's Alan again. The lung associations, provincial lung associations, in my experience, at least in Saskatchewan, BC, and Ontario, have been very influential this last few years in being able to convince the provincial governments in those provinces to give them funding for radon awareness and radon testing. But as we know, it's very patchy across the country.
I guess Ontario has given provincial dollars. I don't think Saskatchewan has invested provincially.
Well, Saskatchewan is they're the biggest. That's their. My understanding from talking to the folks in Saskatchewan Lung Association is they are the most government-funded lung association in the country.
Oh,
so
okay,
they
gotcha.
get huge dollars because obviously they don't only have a big problem with lung cancer because of the number of smokers, etc. But lung health generally is very bad in Saskatchewan for many reasons. Whether it's with asthma or other lung diseases besides lung cancer. So they're well funded, and that's why they've been able to kind of push the boat out this last couple of years with radon awareness. And but as we know, there's they're competing for dollars with everybody else, the lung association. So it's tough.
It's also one level away, even again then from the province itself. And so issues of who holds what data and data quality and consistency becomes watered down when we're relying on nonprofits. It's like we're unloading this problem to the people who are really the least able to support it because they have to compete with all the other lung health related things too. So in some ways, I feel it would be better if the provinces each had a mandate to do this, to collect data about their province annually and provide it to the federal government to map or to collate.
Yeah, I agree.
Yeah, no, that's a good. You're right, Anne-Marie. I think it's how do we get there? How do we get the respective governments to come on side with that idea?
Yeah, I think if the federal government has a good model and between what Jeffrey, Jean-Philippe, Colin, and Michelle are doing, like obviously you guys can get together and come up with some clear recommendations. Jeffrey, your provincial work can tie into, and Jean-Philippe with what the federal government's doing. And then that's a clear template for what could be done if provinces got on board and provided data. That's what I'd like to see we go next is this really could be a great working group.
It's Bruce Becker here. Can you hear me?
Barely, Bruce. You're going to have to speak
Barely?
closer to your mic.
Is this better? Closer to my computer?
Not a lot better.
A lot better?
Not a lot.
Somewhat better.
Oh. All right, then we got it.
Okay, you can chat in, Bruce, if All right. Well, I did promise just 15 minutes more, and really appreciate so many of you being able to stick around and join us. And thank you again to everybody who has joined us today. And thank you for so much engagement on the chat and the questions. Really great information. I will go through the chat. I know sometimes flying on through them, I may have missed one. So I will go back at the chat afterwards and make sure if I missed a question that I follow up with anybody. But really, a lot of this was to gather some of these questions, some of your thoughts for us to move forward. So even if we may not have answered, because we may not have an answer for it right now, but we will take your questions, and I will certainly circulate those to the group that we can work through them as we go forward. All right, well, thank you, everybody. Thanks for joining us. And I would be remiss if I didn't advertise our next sessions. And so we do have other online presentations coming up as part of our online conference. And so don't miss out tomorrow. Colin is doing 7 Signs of a Difficult House. And we do have a couple French presentations coming up. Thursday, we have How to Talk to the Media in French. We do have the English equivalent already pre-recorded that you can find online. And then we do have next week, we've had to postpone our radon and real estate discussion for various reasons. And so that's part of our conference, but it will extend into next week. So we have that in French and in English, and then a Take Action presentation coming up in May. So miss out on the excitement, lots still coming. So thank you again to everybody for joining us, and we will see you tomorrow.
Thank you, Dan.
Thanks, Pam.
Thanks, Pam.
Have a good day.
Thanks, everyone.
Thank you.